Hello and welcome. Thank you for logging on. And thank you to leaders in healthcare for giving me the opportunity to share my work with you. My name is Brendan Harding and I'm a just retired general surgeon and a Jungian psychotherapist. In my early 30s, I had the opportunity to avail of Jungian analysis, and during this process I learned a technique called sand play, though it might better be called symbol play or symbol therapy because it's more about symbols than sand. But I was able to use this technique with some of my surgical patients. And this technique allows easy access to the unconscious. People don't have to be able to talk about themselves or anything. It just happens, and you'll see in a moment how this is. I want to thank the clients or patients and some relatives of these people for allowing me to share their work with you. Most of what you see has been, or all of what you see has been presented before, and most of it is in psychological journals. I'm going to show you some cases using this technique, and then a little video about a little surgical adventure which also illustrates some of Jungian's concepts as well. And referring to my poster, I'd like to explain that to you in two parts, if you like. The first part is that diagram, and it says ego to self. It doesn't say anything about birth to ego. Just a few words about that to say that when the human being is born, for the first year of life, the baby is considered to be still in the uterus. It is so connected, so one with the mother. It thinks that the mother and itself are the one person. And then gradually it goes out into the world, encounters other people, boundaries, it learns about, it can't have everything for itself. Then puberty comes along, excuse me, and adolescence, where there's a struggle to, in a way, break away from parents while we're still feeling dependent on them. And but say by the time we're about 23, most people have developed a reasonable ego. If you become, we'll say, a leader in healthcare, an executive or a consultant physician or surgeon, it's likely you've got a fairly strong ego. Now, the journey of the second half of life is to some extent let go of some of that ego and to journey to the self, which is the real center of the personality. The place where we can be at peace, where we can love, if not unconditionally, less conditionally, and where we might have a greater sense of service. This would correspond to self-actualization, as in Maslow, and corresponds to other things in the different spiritual traditions. To take part in personal development is to be proactive on this journey, and it's good for everybody. But it might be particularly important for surgeons and physicians and healthcare leaders who are at the gateway between life and death for many people. Our profession is trusted more than any other, and we have control over huge resources which cost a lot of public money. And whether we like it or not, we hold projections from our patients which are quite privileged projections, and from the people we work with. So I'd like to present my work to you by showing you some cases, as I've mentioned already. And I forgot on the last piece of video to mention the second part of the poster, which is the picture at the bottom. And that refers to a picture that was made by one of my patients sometime before he died, and it really indicates that he's found a lot of peace, and I'll explain it to you during the case presentation later. Thank you. Hello. This case is about a 32-year-old man who came to the surgical clinic looking for a vasectomy. Well, I asked him why he wanted a vasectomy, and he said if you had the kind of life I had, you wouldn't want children either. And we got talking about this a bit, and in the end he decided to come and have a look at this sand play process that I talked to him about. He sounded interested and he said he'd give it a try. So as it turned out, he came from a very dysfunctional family and he had suffered a lot of trauma as a child, and I'm going to show you now a reconstruction of his tray. This is the area where we work. Shelves with lots of objects. Just slow down a wee bit, maybe to get a look at something. Very good. Yeah, go to the next shelf maybe. And you can see the rainbow, a Viking. That's Brian Baru over there. And that's a cross, a Christian thing, and the butterflies. So there's lots of different objects on different shelves. We don't have time to do them all, but I'm just going to show you how it works, if you like. And I'm going to give you an example of a client I worked with who was 32 years of age, and he had a very traumatic childhood, and the situation had been ignored by social workers and people in authority, and that was a big hurt to him as well. And but I'll show you what he did. How's that? Better. Okay, so he just threw the babies into the sand, and then he put these people alongside, and these were all the different people who should have done something and did nothing. And then he had this quite negative figure up here. They're called Day of Death figures, and they're associated with the Mexican culture of having parties in graveyards on All Souls Night. And while all these things those particular objects look very ugly, if you like, they're about skeletons, they're actually symbols of resurrection. So when this man put these figures in the tray, he was portraying his pain. The babies were abandoned, as you've seen them, and they look abandoned, but they are babies, and that's a symbol of new life. And when he was portraying his parents as these very dark figures, although he didn't know it, he was actually putting in a symbol that's about resurrection. But even more beautiful, what he did was this. At the end of the session, or towards the end, he picked up this, and it wasn't exactly the same piece. It was a different nest and 4 eggs, and he put them in this side of the tray. And he said, that's how fragile we were. And if you know yourself, I remember as a child being told not to go near a bird's nest, and I took out an egg, and it just broke in my fingers. The eggs of wild birds are so fragile. So that's how he put it there, but what it actually means, it's a nest with 4 eggs. So it's new life, and it's protected in a nest. So he's actually moved on, even within the sand tray, the one sand tray, he's moved on from the abandoned babies, at the same time talking about new life, into a protected space for the new life. And the journey with this man was a wonderful journey for him and me. It was a great privilege to work with him, and he made a big difference in his life using this technique. Thank you for listening. This is the original tray showing the 4 eggs in the nest, the 4 babies, and the 2 Day of Death figures. So, some weeks after David made that tray, he made this tray. And he talks about being Merlin. I have the cannon. The house belongs to, he mentions a lady. There are a few people in it. The social workers are there. The man in the grey suit is the legal aid lawyer who told me that he didn't care what I got before I was being sentenced. And he describes various other people. I drove him into the ground, the 2 with the faces on them. And This is another view of the same tray. You can see the people there, some buried. But a few weeks later, he makes this picture. This is me, the toilet. My mother, father, people from social services, legal aid, lawyers, cops, people in general, the church. And you can see that this is a kind of ugly looking tray in a way. He's saying these people are shitting on him. But they're on a bridge, and a bridge is a symbol of transformation, of changing, of moving from one level of conscious to another. And when that happens, things change. And the toilet processes waste. And although his anger, he's getting something out of this work, but it hasn't changed his mind about a vasectomy. And I have arranged for him to see another surgeon for this. And whatever happened on the day, they got into an argument and the surgeon refused to do the procedure. So David went to the hospital manager and complained and was heard sympathetically. And when he came to see me 2 weeks later, I was also sympathetic to him. So he had done a good job, really. He had focused his anger, if you like, and done something about it. And I agreed to do his vasectomy. So our work went on, and here is another picture, again, some weeks later. And he says, "This is how I felt at the halfway house. I am the baby and the chick and the lamb. The lion brings it all out. The casket, suicide feelings, the chair, loneliness, people with youngsters, even that is taken away." And it was around this time that David disclosed the fact that he had quite severe hemorrhoids from which he had suffered for a long time. And he was ashamed of them because he associated the condition with what had happened to him as a child. And I got him seen in another hospital by another surgeon who had agreed to do his operation. They got on well. And 2 weeks before the surgery, David asked me, would I do it? And I hesitated a little bit initially, but agreed to do it. And on the day he came into hospital, we were very gentle with him, treated him with much respect, and everybody was teed up to the fact that he was maybe a little fragile. So his surgery went very well. He had a good experience. And when he came to me 2 weeks later, he wanted to tell me that this had been great for him. And at first I sort of took it from the point of view of me, surgeon, oh, that's okay, don't worry. And then I got it that he was talking to a kind of father figure and sharing with me something that had really gone well for him. And there was a lot that hadn't gone well for him. So I sat there and listened to him talking about this and how good he felt for, I think, about 3 sessions altogether. But this is the tray, and you can't see it that well. So I've reconstructed it also, and I'll show it to you in the other end of the room. This is the reconstructed tray, and David says of this, Waldo is not looking behind him. The fire is burning it all. The house where it started, when I started to realize those supposed to be parents. The casket is suicide thoughts, maybe my brother. The fellow is clean, but not on the inside. And David had a problem with an obsessive compulsion about cleaning himself and would shower 7 times a day if he could. He was down to twice a day when I worked with him. Waldo is looking at the tree of life. The wizard is there to guide him. The people on the stool are nurturing, feeding the babies. Another life, a second chance. The bird is a sign of freedom. When I was in jail, if someone whistled, you got beaten up because a bird is free. I used to feel the same way after a couple of months. After the surgery, I felt like things had changed. So David worked with me for a further few months and then went on his way. And my experience with this, and particularly his experience of healing in theatre, made me think of the theatre in a way like the sound tray, a sacred space. There's so much ritual there. Like when you go to theatre, you put on special clothes, you say goodbye to your friends when you go through the door of the theatre, which is in a different part of the hospital. The people there wear special clothes. They go through washing procedures, keeping everything clean. The surgeons wear special gowns. And then you surrender yourself to the anaesthetist, allow them to put you asleep. So there's a great potential for healing in just the ritual of going to theatre if we treated it like that. This case is about a 56-year-old man who came into the emergency room with a large bowel obstruction. A limited barium enema at the time showed a typical apple core lesion in the sigmoid colon. And later that evening he underwent a Hartmann's procedure by myself. At the time, I checked out the liver and he had a solitary lesion in the left lobe of his liver. And in the following days, the oncologists decided that they could offer him removal of this lesion with the hope of cure. When he got over the operation with me, he came back to my office about a week later and we had a chat and he made this picture. He talked about his life as a hunter and as a hunter's guide. And he spoke about the death of a friend some years previously in a hunting accident, and he talked about his family. And at the end of the session, there was some sadness in the room. As a therapist, we pick up on this. And I wondered about the sadness, and I thought maybe he doesn't feel good about the fact that he had killed at least one moose every year since he was 17. But 2 weeks later, he went for his cancer surgery, and very sadly, the surgeons encountered bleeding on the operating table and the patient died. And there was something about him that stayed with me for quite a while afterwards, a few months. Every so often I'd think about him. And it was December and snowing in Newfoundland, and I was heading back to Ireland overnight. And I was thinking about this man that evening, and I thought about how sanguine he was. What a beautiful tray he had made. What a beautiful picture. It was the moose and himself were kind of one. When the object at the center of the tray is often reflects on the person themselves at a deep level. And it's like his life was in danger in that moment, just like he was remembering the moose's life would be in danger when he came into his sights. And in the tray too is also the fact that the horseshoe on the right should have the open end up to hold in your luck. And the black object on the left is an owl. And the hunter put it there because the owl was his companion on more than one night in the forest. But the owl, while we are familiar with it as a symbol of wisdom, it's in fact in many cultures and throughout history has been connected with death. And then the starfish is a symbol of healing. The starfish can heal itself from almost any wound. So I was thinking about this man and how dedicated he was to his job, how important it was for him to make sure the moose didn't suffer, especially when he was a hunter's guide. And I realized that he wasn't sad about his life, but I had a projection. I thought there was something less about his type of life. And I understood that, I kind of made a mistake, and I had an attitude that in that moment I became aware of. And that's like a bit of personal development, becoming aware of your own shadow. And as it happened later that evening, it was snowing. We went above the clouds, and the sky was so bright as I was sitting back that I noticed, and I leaned forward. I was still thinking about this man, and I looked out the window, and there was Orion, the hunter, and it was a synchronistic moment for me, and an acceptance of my own little piece of, how would we say, attitude. So I'm grateful to my friend the hunter